This is the December 26, 2021 COVID update by the HiPAM modeling team. Parameters have been adjusted based on the past week of data. Honolulu trajectory follows our previous projection corresponding to the model fit. The outer islands are cause of concern. They are surging now and have limited hospital and ICU capacity. The coming week will be key to determine more accurately the rate of the surge. Honolulu numbers from the past week suggest that our estimate that Omicron is 2.5 times more transmissible than Delta is a good estimate. It is therefore again used in our simulation. Moreover, our model is currently estimating 104 hospitalizations in the state versus the actual number of 100 hospitalizations. It suggests the reduced probability to develop more symptoms with Omicron that we have estimated is a good estimate. Finally, we adjusted the travelers for all the counties in order to reflect the increase due to the holidays. There is still a lot of uncertainties regarding Omicron's parameters. However, we have refined the cone of uncertainty based on last week's data, which results in a more conservative scenario for the worst case. Indeed, we now assume an upper bound of 2.6 times more transmissible for Omicron versus the 3 times more transmissible for the worst case, and we're assuming 2.4 times more transmissible rather than 2.0 more transmissible. This is done for all the counties. The model is estimating that Omicron community spreading started within the first 2 weeks of November on Honolulu, and about 12 days later in Hawaii County and Maui County, and in early December for Kauai County. Our model forecast is estimating that the peak for daily cases for Honolulu County will be in the second or third week of January, and that the peak for hospitalization will follow about 9 days later. While the model estimates that hospitalization will be in control by the end of the year 2021, there is potential to go over capacity at the peak for hospitalization, but more data are needed in order to be assertive. Hawaii County is surging extremely rapidly right now with the latest data in the upper part of the cone. It is concerning. While hospitalization have been modeled, there is still a lag compared to the daily new cases, so more data are going to be needed. The same scenario is valid for Maui County. It is surging extremely rapidly right now in the upper part of the cone of uncertainty. Regarding Kauai, it is a bit more uncertain due to the very recent surge over just the past few days, so we're going to monitor the situation on Kauai.